are live at Health and Wellbeing at Work 2026, and I am super excited about this episode. I got you both together. We got Jo and Rachel. Yeah, for those, everyone knows you already, right? But for those who might not know who you are, do you want to introduce yourselves?
We are co-managing partners of Affinity Health at Work, and we're also academics at Birkbeck, University of London. I guess I've been working in this field for 20-something years. I'm running Affinity for 20 years.
20 years?
Yeah.
So it coincided with this event, right? This is 20 years old today, I think.
That's true.
Yeah.
Yes.
Oh, is it?
I think so, yeah. Yeah.
We're not officially saying we're 20 years old until June. I don't know why, but so that's, yeah. You've got an exclusive.
There you go. There you go. But not inspired by the event to kick off the business, no.
No, but exciting to know that they've been
interesting.
running for 20 years and the profession is maybe kind of aligned all together.
And I wonder when we first started coming as well. 10 years ago, maybe.
Really? So I'm going to ask you lots of questions, if that's all right, about all sorts of different things. But maybe we start with the 20 years. So what's changed? There you go. That's an easy question. What's changed in 20 years?
Goodness. I think one of the things that was interesting, though, when we set up Affinity, it was really to focus on manager development and the work that we did around management competencies for preventing and reducing stress. And I think, in a way, that's maybe the one area that has changed the least over the 20 years. So we still hear we need to support managers. So it's a good mental note to think, how do we really accelerate that? But there's certainly a huge amount that has changed in the 20 years else.
So just on the manager thing, so do you think there's something that's held that back, though? The fact that we're still not cracked it after 20 years of trying, still the focus. I mean, these poor managers, it's all their fault, right? I don't know.
It's a really hard one, isn't it? I think that I don't think management development has actually gone on so much. I think if we did some work for the CIPD to look at leadership and management, not to do with wellbeing, but just to look at that. And what you see is that field hasn't really developed towards this idea of you actually have to develop people. So it's all about what they need to do, and the literature is all about what they need to do. But how do you get somebody to that position where they can manage somebody, and where that's so? I think that lots of our work on the management competencies has shown that the competencies are only really the start of it. And it's how do you actually sustainably enable people to do that and continue to do that within constantly changing environments. And so I don't know whether it's such that we haven't cracked it, but the environments in which and contexts in which people are working is so different. And perhaps we don't always equip managers with the skills to be able to manage environments as well.
I think also there's that emphasis on quick fixes. And so if you think of over the 20 years, what has really accelerated, there's been a real acceleration in how we think about health promotions and health checks, and bringing that aspect of health into the workplace, which is good and needed and one part of it. But I almost wonder whether perhaps that has been instead of, or in place of really emphasising how we could integrate good work as a focus of wellbeing. And perhaps the industry in a way has overlooked the fact that we need to integrate better with HR and learning and development and business practices, because if we can do that, we'd have a much better solution.
Yeah.
I think, which is where our work really sits, isn't it, in terms of our work at Affinity. But certainly when we look around, everything is quite siloed.
Yeah.
I think.
Yeah.
And I think that's come from the massive growth. Because when we started 20 years ago, we didn't talk about wellbeing. It wasn't really the well-being
What was it?
thing. It was stress at work that we talked about then. And our work with the HSC was all about stress at work. And I think that we've had, with the framework we developed this year, we've had lots of discussions about use of the word well-being, because even though well-being has enabled us to talk about those conditions under which people thrive and good work, that was difficult when the focus was on stress, it's also meant that we've become mixed up and confounded with occupational health or which I think is part of what we do, and also wellness and all the other bits and bobs that are not that kind of complicate the message.
Yeah, I got him. So how do you define well-being? There you go. Right back to basics. Although, bit of a difficult question, right?
Yeah, so I think in our work, we'd use the WHO definition, which is about thriving in all aspects of life. But I also think that different organisations will have different frameworks. And so because all the work that we do is tailored, it's helping them think about, well, what is the definition for you? And therefore, where are your key focuses? So for some, it may also include a focus on MSK. For others, that might be not within their framing of well-being.
Yeah. Like yourself?
Yeah, I agree. I was asked this question. I was interviewed by Judith Grant,
Sure.
and for her book this week, and was asking me about that definition, and said very similarly that we start from a position of the World Health Organization of this kind of all-encompassing, but actually to make it work and to make impact happen, it has to be aligned with where well-being sits, who's responsible for it, what your organizational objectives are, what your strategy is, and so on and so on and so on, because otherwise a definition doesn't mean anything really.
Yeah. That's a better answer than I gave Judith for her book. I can't remember what I said. I was just, I feel like I blacked out for half an hour and then just came to, and I was like, was that useful? And she was like, yeah, it was all right. So we'll see. We'll see if any of it makes it. So you mentioned the framework, something I really want to ask you about, something that I was sort of involved in the development of, although I didn't give you nearly enough of my time. Apologies. But you've launched it now, right?
No, it launches on the 18th of March. So in a week.
Yeah. Although by the time this goes out, that might be in the past, potentially. Yeah. So tell me more about the framework, what you can ahead of time.
It's so exciting.
Go on.
Well, I guess leading on from what Jo was saying about our work being about bringing people together, one of our frustrations is that different groups, different people, different organizations talk about well-being differently, and that the changing in narrative means that as a profession we struggle with things like, what's the definition of well-being? We struggle with saying, what does a well-being lead do? And that impacts on well-being leads not feeling confident in what they do, not being able to advocate for what they do, and for well-being in organizations not being seen as credible. Mm-hmm. So what we wanted to do was bring together all the groups, so bringing together occupational health and safety and HR and lived experience and counselling and psychology to come together and agree, okay, what is it that wellbeing practitioners need to know, and what do they need to do, and what are the skills that they need to have. And so we worked with those different institutions, which no mean feat, and have a framework that everyone agrees to, that is going to be hopefully disseminated. It's a free to access framework, but will also be embedded within the CIBD framework, within the Society of Occupational Medicine framework, within the diplomas that we see coming in for workplace wellbeing, within master's programs. So what it means is that anybody, regardless of whatever field they come from, whatever level of seniority, can see where they sit, to see where their gaps are, and see where they need an external consultant, or where all the benefits of another team member might be.
Love it.
Yeah.
So, it is exciting.
It's really exciting.
Now, I dragged you to an event a couple of weeks ago where we were discussing this, weren't we? And but the way that it worked was I put a number of different claims up on the board about whether we needed more standardization and almost like a professionalization of well-being. And I think we kind of came to agreement that they're maybe not going too far to the point where it becomes, this is the only way you can do it, out of university, and that's the only route through. but more guidance needed due to all the things you mentioned already and a lack of consistency and all that. It feels like there's a sweet spot in the middle somewhere, right?
Yeah, and I think there's room for those master's programs, and there's room for the diplomas that are the kind of one size fits all. But I think we also have to recognise the diversity of the field, and diversity in terms of what we do, and what people own. And so, what we're saying is that you don't have to do all of this, but you need to know what you don't know and know what you don't do. And that gives you strength. And therefore you can then get development in the bits that work for you and your role at the moment and develop in your own way.
It's about finding the missing pieces of the jigsaw, isn't it? Because health and safety officers have really rigorous training. They've got good pathways, and wellbeing might be one bit of their job. And so how does that fit together?
Yeah.
And I think we often talk about those silos. So we work with lots of organisations where wellbeing sits perhaps within HR, but then they don't talk to occupational health because they don't get on or understand each other. And this will be a framework that will really help that, because we'll be able to see, okay, I don't do this, but this is where occupational health are really useful to me, or why they're important. So the aim is that it will also develop cross-functional understanding and working.
Yeah, yeah. And it feels like the right timing for it as well.
Yeah.
You know, you said 20 years. I feel like it's probably 20 years is when this industry, if you want to call it that, you know, there were more wellbeing specific jobs popping up, I would have thought, over that sort of time period. And like you say, there's a risk that, you know, it all gets a bit messy at some point. And I do feel like there is whether it's yourselves and some other individuals in this space as well, like how do we bring it back together a little bit and give people a little more guidance for the right reasons, you know, not so that you can own it and gatekeep anything, but so that you can instill confidence in people.
Yeah. And we all know that for any walk of life, things that we can explain, we feel more confident in. If we skirt around not being able to explain something, then we're never going to get confident. And if you're not confident, then no wonder we're not being able to sell wellbeing in organisations.
Yeah, I'm with you. Yeah. Yeah, so you've talked about the framework, so what's in it?
So it's really interesting, because what we just had hundreds of things that people said they wanted to do. So we had the steering group that was made up of all the institutions. We had over 200 wellbeing practitioners. We then had an expert panel as well, all saying just hundreds of things that people needed to do. And what it boiled down to was that there's a core set of what we're calling professional factors, which are things that might be to do with you as a person. So, for instance, having empathy, having an ethical outlook, your commitment to learning, that are not wellbeing specific, but are really important. Also, organisational factors, so things like organisation and financial management, technological fluency. So there's this first kind of thing that are non-wellbeing specific factors that we all need to have, that are going to be useful for all. So that's where anybody from other disciplines will be useful just to think about that in terms of building those skills. Then the second tranche is, what's the core knowledge that we need to have as wellbeing practitioners? And this was, I think, where we saw real differences in pockets of knowledge or depth of knowledge as well. Yeah. So in three areas, so knowledge about what's the impact of wellbeing, what wellbeing is, and actually how we impact it. So what's the core knowledge we need there? And then the third one is, how do we use that knowledge in practice? And so this is about evidence-based practice in the field of how we source interventions, how we design them, how we implement them, and how we impact on them.
Yeah.
And the more exciting thing about this framework as well is that under each of those, it has three levels that are 3 levels of seniority, which means that you can see at what level your knowledge is, or at what level your skill is, to then be able to identify where you might need to develop as well.
Yeah. Yeah, that's really interesting. So the lowest level of that, what sort of job role would that be? Just out of interest.
Well,
Would that be a champion or?
our thing was that when we first started thinking about this, we thought it was about seniority. So it could be people that come in, and they're people working perhaps as an advisor or an administrator. So you might be not designing the tools, but responsible for signposting or implementing. You might be doing some training elements. You might be organising events, things like that. But what we found was that actually your level of seniority isn't always to do with your experience in the classic way. It's often to do with something as simple as the size of your team. So about 60% of wellbeing leads in organisations work in teams of less than 3 people. And in those type of groups, they're going to have to do all the tasks. They'll have to do the tasks like the supporting, facilitating, as well as the strategic stuff. But in teams of 20 people, which we had some of those, I mean, I can't imagine an organisation with a team of 20.
Yeah.
That they will have people who are really specialised. So they might have people that only work at level 3 or only work at level 2. So, yeah.
Yeah, I know. I love it. Yeah, I came across someone recently who said they had 60 direct reports. I was like, that's not a thing. No, not in wellbeing. And just I can't remember what he did, but yeah.
Wow.
No one can have 60 direct
reports. Remember their names.
Yeah. And how do you get your day job done?
Yeah.
If you constantly.
Yeah. Exactly. There's not much line management going on.
You wouldn't have thought so.
Sure.
No, I ask about that, around the different levels, because there's so many people who are responsible for it that it's almost kind of finding your place in there. I had an interesting conversation as well with Elliot on an earlier podcast today, actually. One of the things that this sort of thing could really help with is he looks at different jobs that are available and kind of looks at the job descriptions. And he was saying one that he came across was head of wellbeing and inclusion. And it had this huge job title, and it's £29,000, the salary. So I feel like that's something that this sort of framework could help with as well, is almost setting the expectations for organisations and for individuals working in this space and level it out a bit, because it's a bit all over the place.
And just being a little bit more specific in terms of what will actually be required. So, better articulating those job descriptions to be more realistic and point to education and experience.
Well, it's just a bit all over the place. Like, say you've got one organisation saying that we want this long list of things for 29,000, and then you've got somebody else offering more money for fewer things, but in a different space, and it's just a bit fractured.
But then head of are often head of, and they've got no direct reports, and they're just one person. So
So maybe it is easy.
We should all have fancy job titles.
That'd make it good, wouldn't it?
What are your job titles?
Managing partners.
Is
that fancy? No.
Yeah, we mulled, didn't we? Were we co-CEOs or?
Yeah, we did.
We did
It didn't feel like CEO matched. We were laughing because you were in that discussion, weren't we, with Amy McCown, with her job title was Intergalactic Guru.
Guru, that was it. Yeah.
Where we need to get more innovative.
Yeah. But the thing I felt weird about, because you set it up just the 2 of you, right?
Yeah.
So at one point in a time, it was just you 2.
Well, Affinity was actually founded by Jo and Emma.
Okay.
Jo and Emma. And then I came on board in 2006. And then it was the 3 of us. And then Emma left in 2019 when Jo and I decided to build a full service consultancy.
Right, yeah. Got you. I was going to say, those early days, you don't know what to call yourself. Because I feel weird calling myself I guess I'm a CEO of me, of myself.
For so long, we had one researcher who would work with us, or over different people over time. But they're really only the last 3 to 5 years that we've started to really change shape and
now nearly 20 of us.
Yeah, that's amazing. It's amazing what you've built. Unbelievable. Like, not unbelievable, because I believe it, knowing you both, but yeah, it's amazing. It's amazing what you built. And you've been on the I should leave this to later on, shouldn't I? But you've been on the most influential list as well, haven't you? You both kicked my butt on that list. I'm like, Yeah, but I'm like number 27 or something. I don't even remember my number. What
I
number?
don't think
You
number's important.
Yeah, yeah. It's all about ranking one another.
Is it?
That's
I
what
think
all
it's
about,
number
right?
of times on. I think there's very few people that have been on more than once. I'd like to be on another time.
Okay. Oh, I've been on 3 years running.
There you go.
There you go.
There
see,
you go.
see,
In the low
so
numbers,
you
but I'll
beat us.
take it.
You've beat us.
I'll take it. I'll take it. So the other thing I need to ask you about is your Engage project. So tell me more about this.
So that is very much based on thinking about how do we engage practitioners from all sorts of different areas of health and wellbeing, to engage with the research that's already been done. So what is the evidence? How do we draw that through into practice? But also, how do we engage practitioners to do the research and to collaborate in research? So what we know from a government agenda at the moment is we need to improve working lives. We need to improve people's opportunities to be in work. But actually our evidence base for knowing what works, how we can support people effectively is not really that strong. And so how can we start to look at different ways where research doesn't just belong in universities, where people are interested in advancing theories and thinking about some really rigorous academic research? How can we democratize that so that practitioners can get involved and feel that it's not intimidating and that they can build their knowledge and skills? And I think one of the things that we've seen has been the growth of programs like the Nottingham MSc in health and wellbeing. And it's so popular, but it's a really big, long commitment as well. And many people are interested, but they can't quite make that commitment. And then what we were also hearing from our different professional bodies was everybody's interested in research, but they can't give the time to it in amongst busy clinical jobs. And also within each of the professional bodies, they don't themselves have the resources to think about what a program of upskilling would look like or connecting others. And so with the London Centre for Work and Health and Guy's and St Thomas's NHS Foundation Trust, we've come together and put this program of research where we've been talking to practitioners from occupational health nursing to physicians to wellbeing practitioners, HR professionals, health and safety professionals, to really understand what is it that they do and how do they collect data, what do they do with that data, what would they like to do with that data, and then also how do they engage with the evidence at the moment, so where are they getting their insights from? And what we know is people would really like to do more of this. They're very interested in contributing, interested in doing the leading edge stuff, but there's just not time built into the way that we do our work. And there's a lot of apprehension. So we still see researchers as kind of doing something very different and mysterious, and it doesn't need to be. It can just be having conversations and writing them up. And so the program is really about understanding what people need and want, and then looking at how we develop a roadmap nationally to bring different professionals together to get involved in research and using evidence.
So what's the output? Is it peer-reviewed literature, or is it a slightly different?
So I think with lots of things that we do, we aim to do a whole range of outputs. So this project is very much mirroring everything else that we do. So we aim for peer-reviewed journals. So we will be writing up a qualitative study and a quant study. We're also hosting a really big consortium event where we're going to be asking people to pull all the evidence together and then help us develop a cross-sector, cross-profession roadmap that involves potentially, I know what I'd like it to involve, but potentially different modules where people can access them in self-driven ways, but also supported mentoring activities, joining people up with researchers so that you can ask questions of experts in fields and so on. So we're going to be developing the roadmap to then try and put that into practice. So that will be the next 3 years of work if we're fortunate in getting funded. But also writing blogs, getting it out to different avenues. So luckily, I think we have very good relationships with different professional bodies, and they all have newsletters which their practitioners and members engage with. So getting it out in lots of different ways.
Yeah, I love that. I love that because it's striking me that, I don't know whether you agree with this, but just recently there's been a real backlash against like the soft and fluffy well-being stuff, right? You know, well-being's not just yoga and fruit and all that sort of thing. Instead, it's proactive, systemic, strategic, your buzzword bingo approach to well-being. Preventative, which I completely agree. However, when you go scratch the surface of that and go on then, show me some preventative, strategic, proactive, things that actually work and the data that shows it works, I'm not sure you'll hear much back. I don't know.
Well, so the Project Oscar that we've been doing, so Project Oscar is acronyms everywhere, but occupational stress research and consultancy, or consultancy and research. But funded by the HSE. And so what we've been looking at is what are the preventative interventions that organisations are running to really protect and promote health and well-being. So oriented around work-related stress. But we also know that so many of these interventions can pivot different mental health and physical health outcomes. Yeah. And so there is a report coming. We can't talk about it yet, but there is a report coming that has kind of coalesced. So it's been a 2-year project where we've brought together the evidence across a range of different interventions. So we've got understanding of what is being used by practitioners. So what's being used in the workplace, coming out with a catalogue so that instead of people using what looks good and is coming in front of them, they can look at a whole range and make decisions about what would be useful for them. Yeah. And then I think really encouraging that test and learn approach, because we don't know enough about many interventions in terms of gold standard evidence. But what we do know is that the ingredients of what an intervention has will predict whether it's going to likely have a good impact. Yeah. How we implement it is going to make a big difference as well. So if we can help people make better decisions about what they're choosing and why, and better decisions around how they're supporting that implementation, then we're much more likely to lead to a good place.
Yeah, you'd hope so.
So that is all coming hopefully later in the summer or autumn. Yeah.
I think there is something about the narrative around preventative interventions that it's very easy to say what tertiary interventions are with, for instance, EAPs. It's really easy to give examples of secondary, but with preventative, we do stumble in terms of, well, it's a job crafting or a job design, or it's improving this or that, and I think it's not so tangible that has a problem. I also,
I was just going to say, I think a lot of it is just about things that are normal work practices that we don't notice are preventative if they're going well. So having a check-in with your line manager, you don't notice that that's an intervention unless you're not having it and you realise you haven't been able to prioritise work for 3 months and therefore it's a problem. So I think we overlook a lot of those interventions that could really make a difference because we just see them part and parcel of common work practices.
And I saw your LinkedIn post, Matt, talking about the fact of that if people don't have the secondary, tertiary, just have the preventative, they'll be like, where's our nice perks? Yeah. And I think that what you see in the research shows really clearly is you need to have interventions and initiatives at each of those 3 levels, for if you include health promotion. And so I think that that narrative at the moment with strategic, preventative, organisational, it's right that we're swinging back this way because it's been ignored. And it's been ignored that the most important thing to create is environments in which people can thrive. But we can't forget that those things are necessary as well. Yeah. We do still need to support people when they're suffering, and we do need to equip people with the skills to cope in environments.
I love that analogy of swinging, like, as with many things, the risk is it swings too far. And
I think with and I'm talking about it tomorrow actually, but in terms of the number of our workers that are managing health conditions and managing multiple conditions is higher than it has been, but it's also going to grow because we've got an aging workforce. So we need to have those measures for support in place, because otherwise we're going to have a lot of people that exit the workforce and can't get the rehab that they need or the support that they need to get back. So we absolutely need to get that. But we do need a bit of a more Swiss cheese model to make sure we've got everything in place, rather than just hooking on 1 or 2 solutions, because that's not going to be enough.
Absolutely. This episode is brought to you by Motorfinity. Motorfinity helps people working in frontline services access exclusive savings on a wide range of cars, with customers saving an average of £7,400.
Exclusive deals, total transparency, and a smoother experience every step of the way.
I'm talking tomorrow about how about that, but also about the growth in the wellbeing industry and the growth in spend and organisational approaches to wellbeing hasn't had the impact. So we're still seeing levels of stress rising. We're seeing resources rise, so the amount of things people are offered, but we're not seeing demands reduce.
Yeah.
So we do need to think differently. We need to do both.
Right. So, right. Okay. So I was gonna ask you why is that negative correlation exist between stress going up and well-being spend going up? Sorry, that's a positive
There
correlation.
needs to be,
isn't it?
there needs to be both.
They shouldn't be moving in the same direction.
So what we know is that increasing resources alone is not going to reduce job demands or reduce work stress.
Yeah.
And there's some really fascinating research that's shown that the difference between countries with legislation or not around work-related stress, in saying that what they're doing is the action plans tend to increase the amount of resources. So to put in more support or to give more training, but not actually addressing what's causing the risk. And if we don't do that, essentially all we're doing is just enabling more and more people to cope, which at some point they won't.
God, yeah. So is it enough for an organisation just to reduce harm as a baseline, or would you do that first and then it's build on it? Or do you think it all just needs to be done together?
You have to do together, because you can't, if you're just reducing harm, you've got many of your people are likely, it's not going to affect, and or they might have life events that mean that they need support. So I think what we tend to see is people either are looking at what they can do to support physical health and well-being or mental health and well-being, but not connected to the work and the job that they're doing, or trying to combat work demands or support the work environment without thinking about what might be going on in somebody else's life and their whole self. And so we absolutely need both, because we're always going to have people that are unwell. We're always going to have people that are going through challenging parts of life, having kids, not having kids, having older parents, all of those sorts of things put additional pressures on. So you absolutely need the support, but you also need to marry that with thinking continually about good job design
and things that enable you to talk about well-being. So there's lots of criticism of mental health first aid but one of the things mental health first aid does do really well is increase narrative around mental health. And what we know is that narrative is really important for adding to a culture whereby people are open, and so therefore will then access the support, or will attend things, will take part in interventions, will be prepared to think about how their job might change. So again, it's not going to address the problem of stress, but it will create an environment where people are more likely to. So we need those.
It's really interesting you mentioned that, because that's one of these pendulums where everyone did mental health first aid, I think because they were hoping it would be the magic bullet that just solved every problem. Then they realised it wasn't, and it was never built for that. And I do see a risk that it swings back the other way. And there was some research recently, wasn't there, that said that it had no effects and no impact. But the limitations of that is it's not considering the indirect effect that it has across the organisation, maybe just creating more conversation. So my take on that would be almost to the extent where, as long as it's not doing harm, like if it was doing harm, if there was a piece of research that said that actually mental health first aid did more harm than good, absolutely we should rethink it. But if it's not causing harm and it does potentially have some of these other positive benefits, and I hear it anecdotally as well, the benefits that it brings, why throw that out when an organisation is, because the risk as well is the organisation says, right, well, that doesn't work, let's get this app, that'll work instead. And it's like, well,
and I think it's that linking
more complicated than that
to the solutions, though, isn't it? And a lot of the work that that we do is about identifying, well, what is the problem? What's the need?
Yeah.
And sometimes it is that we need to have better conversations. Sometimes people are talking anyway, and that's not the solution that is needed. So I think it's not, should we have mental health first aid or not? Is that an appropriate intervention or activity for the problem that we're seeing in our workforce? And I do also think, though, and it's links to a lot of the work that we've seen when we look at the research in this space overall, is we're often looking at the outcome. So we're talking about very big outcomes that are really hard to affect.
Yeah.
You know, we've got so many things that might affect our mental health, both our personal characteristics, our life, our socioeconomic status, and our work. But we're trying to pivot that big outcome with just tiny little investments in the workplace, and that's incredibly difficult. But if we understand what the problem is and we try and fix that, then we've got much more chance of being successful. So I think when it comes to mental health first aid or any programs that are about encouraging conversation, to me, what is really important is, are you giving people a language to have a constructive conversation about what they need in a work environment? And that's often what we don't see, though. So being able to say I'm struggling is one thing, but being able to say, I can see that this is what I can cope with at work today, or these are the client meetings I can do, or the tasks I can do, but this is where I really am feeling vulnerable, or I feel that I can't do that. That's the language we need to be able to have. And I think that's where the health and safety executive management standards do help, because you can unpick work and you've got a framework. You know, there are many different psychosocial risk frameworks and ours as well. And I think that gives you a platform to have that conversation about what about my work can I do and what am I finding difficult? And then you can take action. So it's not, it's more nuanced than should we have it or not.
Yeah, no, I'm with you. I'm with you. See, unfortunately. We just want that magic bullet, right? AI, that's the magic bullet. That's going to sort it all.
When we started doing this, people used to say the magic bullet was an EAP.
All right, okay.
So 20 years ago,
a long way then.
Absolutely was.
Yeah.
And we used to teach the magic bullet as the EAP. If you have an EAP, you couldn't. There was a point up to which, if you had an EAP, you couldn't have any stress litigation cases against you, until one case, which said that, it was about duty of care, and if you ignored that duty of care, regardless of what you had. And now we think that's laughable, but we have really moved on.
Yeah, absolutely. Although everyone's still got an EAP, and some of them lean a little too heavily on their EAP.
Yes,
you know.
Yes, certainly.
Part of a
integrated
solution.
Exactly. Well, it's
I'm with you.
It's all of it.
Yeah, I'm with you. So I mentioned AI there. So you don't necessarily need to talk to me about AI, but you talked to me about the last 20 years. What's the next 20 years look like? We're sat here next to this gorilla, and that won't make any sense because the gorilla's not on camera. There's a massive grass gorilla next to us, but we're sat here next to the gorilla in 20 years' time. What's going on? What's changed? Get out your crystal ball.
Wow.
What do we think's changed? Lots and nothing at the same time, I think, probably.
Yeah. I think that we are seeing it at the moment to move towards, because of perhaps AI and automation, a move towards data. And I think we need to get better as in the wellbeing profession to use the data to understand what works for who and when, and to enable us to use those, which links back to the siloed working we were talking about earlier. So I think we need to start seeing wellbeing as data as an enabler of wellbeing and good working wellbeing.
Is data literacy in the framework?
Yes, it is.
Yeah,
technological
absolutely.
fluency.
Yeah.
And actually we mapped onto 6 different frameworks, and none of them mentioned technological fluency. But the ability to use it, absolutely. Which I would probably fail now.
I know.
Maybe that's why people don't
we
include it.
get dragged into new ways of working. But
The benefits of having a bigger team now.
We do like it when we're there.
Yeah.
I think one of the things for me is also around how we help people work even when they're not well. So what I would love to see is a more nuanced understanding around how we don't need to be 100% fit to work. And we know that the last 100 years, our jobs have been designed around people being perfectly well and, being the only earner as well. We're still fitting in, trying to manage dual income families in a world that work is designed really for a single person that comes home and gets their dinner and doesn't have to do all the other things that go around caring responsibilities and so on. And so I think we're moving in a way that supports a more nuanced and individualized way of working. But I really hope that the future is one where people can work to their capability and their capacity, but we start to design our work in a way that allows that in a more fluid way, really.
Yeah.
And so flexible work being more commonplace and flexible first, which we can see Employment Rights Act is coming in and starting to move us in that direction. But I think unless we have some of these really good structural changes, then we're still going to be having this conversation where we say, oh, well, how can managers play a different role or what can we do? So I think those
So do you think
would be
it's
great.
almost like the legislation and guidance that would drive that? Or do you think it's that organisations might start working in that way and then outperform the market and that becomes the norm?
Yeah, I'd hope that we could gather that evidence to show that the organisations that do take that more proactive approach start to be the market leaders, start to be the ones that innovate and sustain and grow.
But also we never know we don't know what's ahead really, because what we know is the biggest change to work in recent times was the pandemic. That really leveled the ability of many of us to work in a flexible way. That had been wanted and had been requested for many, many years before that. And so I think that there will be lots of levers towards thinking about as Jo said, a form of work that works for everybody.
So we need another pandemic. So
Certainly not.
Something
Maybe not.
different.
Yeah, something different. Yeah, maybe. Yeah, you're not going to say that on camera. Yeah. Cool. Right then. So any final questions that you think I should have asked you and I've failed to do so?
What do you see as the future?
What do I see as the future? Well, so I feel like AI is going to be absolutely transformative and in terrifying but also interesting ways. I meet lots of people who say, oh, well, AI couldn't do my job because of X, Y, Z. Psychologist as an example. AI can't be a psychologist, and I would disagree. Some of the bots that I've seen and the way that, it passes these Turing tests and all the rest of it, I just don't see a limit to that, which is, like I say, a little bit terrifying. But then there's also, like, how do we leverage it going forward? So I think that I don't know, basically, but I just think that will just change everything. But maybe I'm wrong. Maybe it'll just be a flash in the pan and then people will stop using it. Who knows?
People aren't going to stop using it. It's a revolution, isn't it? But I think that we need to move to a process whereby we're not just getting used to it, but in designing our work around with that in mind rather than around it.
And I think thinking how we help our young workers still get opportunities.
Yeah,
because
that's the worry.
That's what worries me, I think, is how we can use AI so quickly to do jobs that we might have previously got somebody in their first role to do. And that's where our real
that is a worry. I mean, look, we're running out of time now, but that is a worry because you've not only got that, but then remote working, which I'm a huge advocate of because I do it and I love remote working. But can you imagine joining the workforce now and you don't get to see anyone? You don't get to speak to anyone. Often you're living in your mum and dad's house, in your back bedroom, and AI is doing half your job and all the rest of it. Yeah, it is kind of scary from that perspective. Yeah.
Wow,
That's
maybe
a cheery place
one
to
for
end
another
on.
day.
Yeah. We'll figure it out. Yeah. Well, thank you so much for your time today. Really appreciate it. Enjoy the rest of the day. As people know where to find you, but I should let you do one little plug. Well,
189.
Well, tell me about the framework. Where do people find?
Yes, just go to the Affinity Health at Work website and you'll be able to click through on there, or follow Jo and I, and we'll be posting about it lots.
Perfect. 18th of March.
Yes.
Yeah. Amazing. Right. Thanks so much.
Thanks, Matt.
Thank
Good to
you.
see you.
Cheers. Thanks for listening to this episode of the Working Wellbeings podcast, recorded live at Health and Wellbeing at Work 2026. This episode was part of the Full Tank Thinking series, sponsored by Affinity. For more great episodes, click the link on screen now. And for more information about Motifinity and the work they do, check out the link in the description below.